Hello, and welcome to another episode of Let's Talk About Shh. This podcast is aimed to help you navigate your relationships, maximize your pleasure, and get the most out of your sex life. Each week, we cover different topics related to the full spectrum of sexuality, romance, relationships, communication, consent, and more. My name is Tila. I'm a sex educator, relationship expert, and published author. It's a common question I get that people ask me why I choose to do sex ed, and it's because I love talking about sexuality. I love helping people connect with their partners, make meaningful connections, and get the most out of their sex lives. So if you're struggling with an area around sexuality or relationships and have a question that you'd like answered, please send in your questions to questions@exploresextalk.com. Of course, also please feel free to check out my website, exploresextalk.com. I've got lots of free articles and tips on there. So, this week, I want to talk about prostate cancer. Now, I know that's a scary subject, but it's something that we all need to know about and need to know the signs because early detection makes a huge difference. This is the most common form of cancer for the penis-bodied, with an estimated 191,930 diagnoses so far in 2020. It's also the leading cause of death for penis people, with an estimated 33,330 deaths in 2020. So it's a big deal. Something we need to know about. It's something we need to watch out for. For anyone who doesn't know, the prostate is a small walnut-sized part of the penile reproductive system. It's found in the rectum, just below the bladder, and it's responsible for adding nutrients and fluid to sperm. So it's an important part of the reproductive system and can actually be a really great source of pleasure for people with penises, but that's something we're going to cover in a different episode. At this time, we don't know what causes prostate cancer. But we know that it begins when cells in the prostate develop changes in their DNA. The cancer starts in the prostate, and some forms will grow slowly, while others will be more aggressive. One thing is for sure, though, if it's left untreated, it can spread to other areas of the body in the same way that other cancers do. There are also certain factors that can increase the risk of prostate cancer. Age is unfortunately a big one. The risk of prostate cancer continues to increase as people grow older, and the most common age of diagnosis is after age 50. We also know that Black people are at a higher risk than people of other ethnicities. Of course, family history also plays an important role. If someone has a history of breast cancer in their family, or if a blood relative such as a parent, sibling, or child has been diagnosed, then they're at increased risk as well. One of the last major risk factors we know about is obesity. There's a lot of evidence to show that those who are obese have a higher risk of prostate cancer and are more likely to have a more aggressive form of it. It's also more likely that people who are overweight can have their cancer return after initial treatment. Now, as I mentioned, there is some good news. The sooner it's detected, the better the prognosis and the chance of recovery. So let's dig into those signs, because a lot of people don't actually know what to look out for. Unfortunately, these signs are not always present in the early stages of prostate cancer, but we do know some things that are some common indicators. People should take special notice if they're having trouble urinating, or maybe they're experiencing a decreased force in the stream of the urine. They could be seeing blood in their urine or semen. It's experiencing bone pain, losing weight suddenly without trying to lose weight, or experiencing erectile dysfunction. Now, if you've experienced any of these, please don't immediately panic. There's also a lot of benign reasons for why some of these things may be occurring. But if you're noticing any of those symptoms, it's really important to follow up with your doctor just in case. If there is a concern about prostate cancer, your doctor may run some tests. A really common test is a PSA test. PSA stands for prostate specific antigen, and it's a protein produced by the cells in the prostate. It's normal for PSA to be found in the blood in small concentrations, and the amount can actually rise if there's a problem with the prostate. So, a PSA test is a blood test that measures the amount of PSA in the blood. And this can be used to identify a number of prostate conditions, not just cancer. So, if it turns out that a PSA test comes back with high levels, your doctor may look at your overall prostate health, personal history, and other factors, and may order a digital rectal exam. In this exam, the doctor will insert a gloved and lubricated finger into the rectum to feel for any irregular lumps or hard surfaces or irregular areas on the prostate that could indicate the presence of cancer. A healthy prostate should feel soft, smooth, rubbery, and symmetrical, so it's fairly easy to detect something that is irregular, particularly if it's a bit larger. If any irregularities are found, a biopsy may be the next step. A prostate biopsy, which is also called a transrectal ultrasound, is used to determine if irregular or suspicious tissue is cancerous. Typically, a person is given a local anesthetic, and then the ultrasound probe is inserted into the rectum. The needle on the probe will actually quickly pierce the rectal wall, enter the prostate, and remove a tissue sample. And typically, anywhere from 8 to 12 samples will be taken depending on the area of concern. And the whole procedure is fairly quick and only lasts about 15 to 20 minutes. If it's been determined that the tissue is cancerous, the doctor can and may order some additional tests to determine if the cancer has spread beyond the prostate. This isn't always necessary, and your doctor will determine what's best based on the individual results so far. Now, if cancer is found, there's actually a number of different treatment options available, and the best option will depend on a number of different factors. In some cases, if the cancer is determined to be low grade, it may not actually need treatment right away. A doctor may recommend active surveillance, so basically following up with future blood tests and sort of keeping an eye on the issue. This can be a really good option if the cancer isn't actually causing any symptoms and is expected to grow very slowly and stay confined to the prostate. Surgery is also an option for treating the cancer so far as it's confined to the prostate, but maybe is a little bit more aggressive. So in this case, surgery would remove the prostate gland and some of the surrounding tissues. Another option on the table is a radiation treatment. So radiation therapy uses high-powered energy to kill cancer cells. Not everyone knows this, but there's actually two different types of radiation therapy that can be used. One type uses radiation that comes from outside of the body. So this happens when somebody lies on a table while a machine moves around the body, directing the beams of energy to the cancer. And the other type is when the radiation is placed inside the body. This is commonly called brachytherapy. So it involves placing small, rice-sized radioactive seeds inside the prostate tissue. And these seeds deliver a low dose of radiation over a longer period of time. Depending on the situation, a doctor can actually recommend both types of radiation being used. Another treatment option is freezing or heating the prostate tissue. Freezing or heating therapies are usually recommended for very small cancers where surgery isn't possible. So a freezing treatment will involve freezing the prostate tissue using a really cold gas. It's then allowed to thaw, and then it's frozen again. The cycles of freezing and thawing kill the cancer cells and some of the surrounding healthy tissue as well. But it's usually effective. In heat therapy, a high-intensity focused ultrasound is used to heat the prostate tissue and cause the cancer cells to die. So that's another way to go. Hormone therapies are yet another treatment option and one that's commonly used. So this type of treatment stops the body from producing testosterone, which the prostate cancer relies on to grow. So cutting off that testosterone supply can actually cause cancer cells to die or just grow more slowly. Typically, this is an option used to treat more advanced forms of prostate cancer in an attempt to actually shrink the cancer and make other options more available. Another option is chemotherapy, which I think is one that most people have heard of when in connection to cancer. Chemotherapy uses drugs that rapidly kill growing cells, including cancerous ones. So this is usually a course of treatment for prostate cancer that is actually spread to other areas of the body as well. It can also be an option for cancers that have shown no response to hormone therapies. Immunotherapy is a treatment option that uses your immune system to fight cancer. You see, this may not automatically be happening because cancer cells are really tricky. They produce proteins that help them hide from your immune system. And your immune system doesn't know that there's actually bad cells that it needs to kill. So there's two ways this therapy can be used. One way is that medical professionals can engineer your cells to fight cancer. They take some of your own immune cells and engineer them or train them to identify and fight prostate cancer cells. Then these cells are injected back into your body and do the work. The other option is immunotherapy drugs that help the immune system identify and attack the cancer cells. Both of these options may be considered when hormone therapy is no longer effective. The last treatment option I want to mention is a targeted drug therapy. This is when they use drug treatments that focus on specific abnormalities that are commonly present in some cancer cells. If the drugs can effectively block these abnormalities, it can actually cause the cancer cells to die. This is another good treatment option if hormone therapies aren't working. However, it's important to note that it's not effective for everybody. The best course of treatment will be unique to the situation and best determined by consulting with your medical professionals. I know this is a super scary subject, but it's an important one and not something that we should avoid talking about. It's an important part of your health, and people need to know this kind of information so they can look out for those early signs that we talked about. It can be the difference between something that happens or something that dramatically impacts or potentially even ends a life. So please do not avoid this type of information. I know it's scary, but it doesn't have to be. As we talked about, there's all these different treatment options. And the earlier we get to it, the earlier we identify it, the earlier we start those options, the better chance someone has. So do not put off going to the doctor if you have any of those warning signs or if you're concerned about something. It's important to get checked out. It's important to keep an eye on it. It's important to practice prevention, There's a bunch of things people can do to prevent prostate cancer. The best things that people can do are in line with maintaining a healthy lifestyle, choosing a healthy diet that's rich in fruits and vegetables. I know, guys, you don't like to hear it, but seriously, fruits and vegetables. Very important for prostate health. We sort of talked about that an episode or a few episodes ago. Also, getting regular exercise, maintaining that healthy body weight for your age and height and body type. And if you have a high concern about risk for prostate cancer, if it runs in your family, if you're part of that risk group, consult your doctor for any additional options. There are some ways we can safely reduce the risks that are customized and appropriate to your health history. This includes certain drug treatments. This includes certain regimens and recommendations by your doctor. So talk it over with your doctor if you're really worried about it. So that is all we're going to cover today. I know it was kind of a heavy topic, so I wanted to keep this episode sort of shorter. It's not meant to be scary, but it's important to know. So thanks to everybody so much for tuning in and sticking with this episode. I hope you share it. If you have any questions or concerns or thoughts about prostate cancer, if you want to share a story, please feel free to send that in. Always to questions@exploresextalk.com. Also, if you enjoyed this episode, please hit that subscribe button, like it, share it, recommend it, share this knowledge with someone else. It's important stuff. And I look forward to seeing you again next week for another great episode. And of course, as always, please stay safe and stay sexy.